Today's topic is about the best treatment for herniated discs. We treat a lot of herniated discs, and we did another video and somebody asked me a question, does that happen every time? And we're going to talk a little bit about how that treatment works, because they weren't too sure. So we are the Illinois Back Institute, and we specialize on treating back pain, and our goal is to give you information about how to solve your back problems, to give you the tools, because doctors are not obligated to report their findings. So our goal is to help educate you. The better educated you are about your problem, the more likely you are to get better. This is a typical spine here. Head's here, the hips are here. There's 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone there is a disc. The disc allows for motion. Also, the disc allows enough room for a nerve to exit directly off of the spinal cord. Inside the spine is the spinal cord, so the spinal cord runs down through the inside, and then through these little openings here called the foramen, there is a nerve that exits directly off of the spinal cord, and that space is created by the disc. And what can happen sometimes is that disc can start to come out between that space. That's the herniated disc. So the disc is a lot like a jelly donut, in the sense that the outside of the disc, there's a thick material we call the annulus. Inside the disc, there's a jelly-like substance called the nucleus. The nucleus is designed to move around a little bit. But what can happen is when you have a change in the load on the disc, the annulus can start to break down. The annulus is the outer portion. So when the center of gravity goes directly through the middle of the disc, so when the center of gravity goes straight down like this, the stresses are distributed evenly throughout the annulus, and it's through the nucleus that the stresses are distributed evenly. But what can happen sometimes is you can change the angle of the load. When you change the angle of the load on the nucleus, if the angle changes, very often what happens is it'll start to push the annulus out. It'll start to push the nucleus out, and in this area of the annulus, you'll start to get a breakdown, and you'll develop a little tear. It's called a fissure. And because the nucleus is a jelly, the nucleus will start to push out through the fissure. That is the herniated disc. Looks like this on an MRI. One vertebrae on top of the other. So we're looking at this side view right here. So we're looking at this view, and you can see these are the vertebrae, and in between is the disc. This is the disc material. This is the spinal canal. This is a slice, so you're seeing inside, this is where the spinal cord would be. Now typically on an MRI, what you want is a smooth transition from one vertebrae to the next. And you can see down here it's pushing out here. This is the herniated disc. This is the outer portion. This is the top view. This is the outer portion. This would be the jelly. You get a tear in the annulus, and the nucleus starts to migrate out. That's the herniated disc right there. So you can physically see it on an MRI. But also, as that nucleus starts to push out, it's going to start to cause a little irritation to the nerves. That's obviously going to cause you pain, but at the same time you may have sciatica. The number one reason people have sciatica is the herniated disc. The nuclear material pushes to the outside. So what is our goal? Our goal is to take pressure off the disc. And as we take pressure off the disc, what happens is the disc starts to move back to the inside. So the way we treat it is we take pressure off, and then we strengthen and stabilize muscles. We take pressure off and we strengthen and stabilize muscles. There is no drugs or surgery that is a part of our therapy. And as we do that, the nuclear material starts to move back to the inside. So what's our goal? Our goal is to eliminate the abnormal pressures on the disc that's forcing the nucleus to the outside, heal the damage to the tissues that are aggravated, and then strengthen and stabilize the spine. Functional disc stabilization. Heal the disc, activate the muscles. That's what we do. So we have 419 case studies. Because somebody asked me the other day, does it happen? Does it happen just one time with your patients, or does it happen? Well, this is something that we do often. We treat a lot of herniated discs, 419 cases. Of these cases that came to see us, 52 had gone through physical therapy and not gotten any better. 23% had gone through chiropractic and not gotten any better. 35% had cortisone shots, and 48% were taking narcotics. So these are treatments that they had tried before they came to see us, and they did not get any better. They came in to see us. Now, let me just say one thing. Because we have this ability to take pressure off the disc and get healing in the annulus, we're able to solve these types of problems. The reason these patients didn't get better, and this is kind of like that video yesterday where we said there's a spectrum of back pain. They didn't get better because physical therapy wasn't enough to stabilize the spine and take the pressure off the disc. The chiropractic wasn't enough. These didn't work because they didn't address the issue in the disc. When you address the issue in the disc heals. That's what we do. These don't. They're good at a certain level along that spectrum, but above and beyond that, they don't get the patient better, and that's where we come in. We can solve those problems. So these patients had gone through all these therapies and not gotten better. When they started our therapy, and I'm not going to talk too long about the oswestry, but their oswestry disability index was a 46. A patient with a 46 that has failed therapy is a surgical candidate. So we know these patients were candidates for surgery. Their ending oswestry after having gone through our program was a 9. It's scored on a scale of 0 to 6, and there's 10 questions, and we score it, and it goes from 0 to 100. So 46 means you're disabled at 46%. When they were done, they were 9. When beginning pain was a 9. When they were done with our therapy, their pain was a 0.8. So they had gotten better by 37 points. This is important because when you look at studies about how effective a treatment is, you look at this number right here. It's the oswestry disability index. Their number was a 37. Our number was a 37. So they got better by 37 points. The pain got better by 7.2. These were surgical candidates. There's 419 patients. This is what it looks like. Patient came in, herniated disc. Here's the disc, here's the vertebrae, herniated disc pushing into the spinal canal. Went through the program, disc moved slowly back to the inside. By the end, the herniated disc completely gone. Here's another one. Very large herniated disc. You can see it here. After the therapy, herniated disc was gone. Again, it's about taking the pressure off the disc, getting the nucleus to move back to the inside, and strengthening and stabilizing the muscles. Same thing here. Nuclear material pushing into the spinal canal. After the therapy, herniated disc was gone. More of the same. Okay, bulging disc here, herniated disc here. After the therapy, nucleus was gone. Same thing. Bulging disc, herniated disc. After the therapy, patient was better. Same thing. Herniated disc pushing into the spinal canal. Herniated disc pushing in at the end, better. Here's a neck. We don't talk a lot about the neck, but we treat a lot of neck patients. Same thing. Take the pressure off the disc, get the healing of the disc, reactivate the muscles. Very, very large herniated disc. Pushing into the spinal canal, actually pinching the spinal cord. You can see here's the brain stem, the spinal cord that runs down through the inside. Herniated disc pinching the spinal canal. At the end of it, herniated disc better. Okay? We have a study. In this study, it was identified that we have the best program for eliminating chronic back pain, including the herniated discs. Okay? So we know that this is the best treatment. We have the study that proves it. We also have other case studies, because it's not just about the herniated disc, it's about the disc. And when you heal the disc, it doesn't matter if it's herniated, if it's bulging, or if it's degenerated. So we have 265 case studies of patients that had spondylolisthesis. We have 758 case studies of patients that had a degenerated disc. If 790 cases of patients with bulging disc. 752 cases of patients with sciatica. We treat more sciatica than anybody, and we treat it successfully. 718 cases of stenosis. So if you have back pain, doesn't matter if it's a herniated disc, bulging disc, degenerated disc, and you're not getting better, we're here to help. We do these videos so you know that you have options. This is an option for bad backs. We're here to help you. We want you to like our Facebook page. We want you to share our information. And if you want to watch more videos, we have all our videos archived on YouTube. So subscribe to our YouTube channel and share our information. So that's it. It's Friday. It was a long week. I'm a little tired. Gotta go home. So I'm done. We'll see you next week. Again, Tuesday is tips, Wednesday is stretches, Thursday is exercises, and Fridays about why you have the pain. So have a good weekend. Be careful. Cameraman's turning off the cameras. And we'll see you next week. Next week.